Upon entering the room, proper hand hygiene was performed. Good morning, Daniel. My name is Jeff. I'll be the JSU nurse practitioner student examining you today. Is that okay?
Yes.
How are you doing today?
Very well.
All right, no problems. All right, so we're going to do a neurological exam, and first I'm going to start off with the cranial nerve test. Okay. So first, I'm going to get you to include one nostril, and we're going to do a smell test, and see if you can identify these smells.
Lemon.
Correct. Include the other nostril. Same thing. Just let me know what the smell is.
Peppermint.
Correct. Okay, we're going to move on to cranial nerve number 2, which focuses on the vision. If you could cover one eye and read this chart. For the purposes of this demonstration, we're going to read the last line that the patient can identify correctly.
ADEFKTBC.
Correct. Good with the other eye?
ADEFKTBC.
Correct. Patient shows 20/20 vision. I'm going to shun this ophthalmoscope and look in your eye, okay? So looking at the fundus. Fundus is clear. Same thing over here. Fundus is clear. Alright, good. Now I'm going to test your peripheral vision. Cover one eye. I'm going to do the same with mine. Tell me when you see my finger moving. Alright. Same thing. Good. Other eye. You do the same thing. Alright, good. And that's the cranial nerve number 2. So now we're going to test 3, 4, and 6 all together. I just want you to follow my finger with just your eyes. Okay, good. I'm going to shine this light in your eye just to see how your pupils react. Pupils are symmetrical and they react symmetrical. Alright, so now we're going to test cranial nerve number 5, trigeminal nerve. First, I want you to clench your jaw. Good, testing the mastoid muscle. Now I want to test your sharp and dull response, or your facial response. Close your eyes for me. Tell me when you feel this, okay? Okay, patient correctly identified touch. Now we're going to do sharp and dull to identify the differences. So, feel that?
Yes.
And that?
Yes.
Alright, was there a difference?
Yes.
Okay, so the first one was dull, the second one was sharp. Now I just want you to identify whether you feel sharp or dull, okay?
Yeah. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
That's good. And that is cranial nerve 5. Now we're going to move on to cranial nerve 7. What I want you to do is smile, show me teeth, frown, wrinkle your eyes, up. All right, good. And we're going to do a taste test, and this is going to be bitter and sweet on the anterior 1/3 of the tongue, 2/3 of the tongue. And I want you to identify whether this is sweet or bitter. I mean, sweet or salty.
Sweet.
Correct.
Salty.
And that's correct. And that tests cranial nerve 7. We're going to go on to cranial nerve 8. We're going to do for hearing. If you could cover one ear, and I'm going to whisper in your ear, and you tell me what you hear.
17. 42.
Correct. Now cover the other ear. Do the same thing.
12. 14.
Correct. Now we're going to test your air and bone conduction. You tell me when you stop hearing vibration.
10.
Tell me when you stop hearing. Alright, same thing on the other side. Tell me when you stop feeling it.
Okay.
And when you stop feeling it. Okay. Patient shows normal hearing, no hearing loss. Now we're going to go into test cranial nerve 9 and 10. They will be tested together. First, I want you to take a sip of this, and I'm going to calculate your thyroid and throat when you follow. Okay, symmetrical. Stick out your tongue and say "ah." Ah. All right, now I'm going to test your gag reflex. Okay. All right, gag reflex is intact. Uvula reacts symmetrical on both sides and no abnormalities with the palate. And that's 9 and 10. So we're going to move on to cranial nerve 11. You're going to test your muscle. Up. Okay. Push against my hand. Push against my hand. Good, good. All right, now we're going to test cranial nerve number 12, which is going to be the muscle. Okay, you stick out your tongue straight. Push down. Push up. All right. Tongue is symmetrical, no deviations on either side. All right. So now we're going to go into the cerebellar function and the proprioception. What I want you to do is take your hands, place them on your thighs, turn them over, and then go over like this. All right. Faster. Good. All right. You can stop. Now I want you to take one hand and touch your nose, and then touch my finger. All right. That. Good. All right. Now try it with the other hand. Good. For the sake of this next one, I'm going to pick mine. Just be careful. I want you to touch your nose and close your eyes, and then touch. Yeah, there you go. Be faster, faster. All right, stop. Okay. Now I want you to take your heel and put it on your shin. Go, move it up and down. Faster. Good. Okay, stop. Do it on the other side. Same thing. Good. Okay, stop. All right, now I want you to stand up. Let's slip off of that. All right, so now we're going to test balance. What I want you to do is close your eyes, and I'm going to stand beside you in case you fall. Some swaying is normal, but you shouldn't have so much as to lose your balance. All right, now I'm going to give you a little shove and just test your balance, okay? Good, good. Okay, you can open your eyes. Stand on one foot for me. Patient should be able to exhibit standing on one foot and maintain balance for at least 5 seconds. All right, switch, other foot. Some swing is normal. All right, push foot down. I want you to walk a straight line, just normal strides. All right, turn around. Now this time when you walk back, I want you to heel to toe like this all the way. Heel to toe. All right, patient's gait, stop, and you can have a seat back. Patient exhibited normal posture and gait. All right, so now we're going to move on to the sensory portion of the test. Since we tested the touch in the face, we're going to not do that now. We'll just do it in other parts of the body. And what I'm going to do is a sharp and a dull. And I want you to tell me where I touch it. First, we're going to do just touch to identify, and then we'll go into sharp and dull. Can you close your eyes for me? And for most of these tests, I'm going to have you have your eyes closed, okay? You just tell me where, point to where you're touched. Okay, good. Now, we're going to do a sharp and dull test. I want you to identify whether it is sharp or dull, okay? So this is sharp, this is dull, okay? Do they feel different to you? Okay. I want you to identify which is which.
Sharp. Dull. Sharp. 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 Sharp.
All right, good. Which one identifies sharp and dull? Now we're going to go into conduction, being able to test for vibrations. All right, I'm going to put this on the bony promises. Let me know when you feel it.
Okay. Okay. I feel like it's not vibrating anymore.
Okay. Yeah.
Okay. 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 Not five, maybe it's slightly vibrating.
Okay.
Good. Okay. Okay. Okay.
All right, good. So, with your eyes closed, we're going to do a direction. I'm going to take your fingers, go up or down. I'll show you the difference. This is up, this is down. You recognize that? Okay. So you just tell me if I'm moving it up or down.
Up. Down. Up. Down. Down. Up. Down.
Yeah, that is correct. Now, if you turn your hand over, I'm going to place something in your hand, and you just identify the object that I put in your hand, okay? Okay, on the other hand?
One.
Correct. Alright, so now I'm going to draw something in your hand, and you just let me know what I draw, okay?
A.
Correct.
0.
Correct. Yep, that's right. Alright, so now we're going to move on into the next section of the test, which is the reflex. Okay? So we're going to be checking your reflexes. We're going to start with the hands, work our way up, and then work our way back down, okay? So first we're going to check the brachioradial reflex. Just some squats. Yeah, over here, just relax your arm, okay? This is the bicep reflex. Good. Turn your arm over, and then over here. Good. Reflex plus 2. Same thing, we do tricep first over here. Just hold it out this way. Good. And turn. We'll just relax your arm. Relax, relax. Bicep reflex over here. Plus 2. And then we do the brachioradial reflex over here. Good. Alright. The next one I'm going to do is your abdominal. And if you will lay back for me, I'm just going to pull your shirt up for me just a little bit. I'm going to stroke you here, and then you will see normal. You'll see the abdomen react to that way that I'm stroking. Alright. So normal findings there. You can put your shirt down. Now, in a male, we would normally have them undressed from the waist down. In this instance, we won't, but I will stroke proximal to distal on the inside thigh, and you would notice the scrotum rise on that side that's being stroked. So now we're going to move on into the patella reflex. I'm going to strike again. Okay. So we're jumping. We're going to strike this one. Good. That's 2 plus in the patella. Next, we're going to go to the Achilles. Just relax. Relax the foot. There's the foot. Go down. That's plus 2. I'm going to check on here for ankle clonus. Good. And then I will check the Babinski. Alright. Those are all within normal findings. We'll check the Achilles over here. Good. And I'll check ankle clonus. And then I will check the Babinski or the plantar reflex over here as well. Okay, and those are all 2 plus and within normal findings. Anything else I can do before you run out? No? That's it. Thank you, sir.